Health St. Luke's now offers virtual care options for children in Iowa.
Virtual healthcare is an option for families even in the post-pandemic era. I looked at how this new program works in this Healthbeat 4.
Goal is to get your answers to your medical needs as soon as possible. The new virtual care model now includes children ages 2 years old up to 17.
And this just expands it down to the little ones and giving parents an option should they not be able to come in to see their pediatrician.
Virtual options include an online screening tool called Smart Exam, asking you questions to assess your medical need, or do a video visit with a provider in the state.
If you need to see a doctor, you don't have to leave your home or wherever you're at. Technology makes this as easy as possible for you.
With the lift of a screen, virtual clinics at UnityPoint mean you can see a doctor from just about anywhere.
Providers that staff these two virtual options, both the Smart Exam and the Virtual Urgent Care, are employees of UnityPoint Clinic, and they're there 8 to 8, 7 days a week to offer services to the community.
UnityPoint Health says that through the video visit, providers can diagnose, recommend treatment, and prescribe medication. If you don't want to go the video route and would rather answer questions, within 1 hour of the Smart Exam assessment, a provider reviews your information and will either send in a prescription or a request that you be seen in person.
People have been seeking care for their children this way, both ways, as it is convenient, and it can be pretty hectic this time of year right before school gets started.
For Healthbeat 4, Taylor Deckert, KTIV News 4.
You don't have to be a former UnityPoint Health patient to use this service. It's available to anyone seeking a convenient virtual option. Get started by checking out this story at ktiv.com.